Dr. Salvador Medina. I'm talking to you.
Hello, everyone. This is a broadcast that we're doing with Dr. Salvador Medina. I'm his media producer, and he's going to be responding to a couple of your questions that you had throughout the day. So here he goes. I'll let him speak.
Hello, everybody. I'm Dr. Salvador Medina. I'm talking to you from my home here in Tijuana, Baja California. I want to thank Mayra for helping with this broadcast. I'm talking to you during this difficult time. I know it's been tough for everybody during this lockdown. It's not easy to stay home, not being able to do a lot of our regular activity. This creates a lot of stress and tension. So I just basically wanted to talk to everybody, let you know a few things that we have in mind that we're planning to do. There's a lot of questions that even I and the medical community, we have as to when we're going back to work and how we're going to do everything. First of all, I hope everybody is safe and doing well. So just to give you a little bit more information of how this is going to work. This changes very rapidly the situation that we're living in. So nothing is absolutely for sure, but what we're planning right now, right now, of course, the office is shut down. We're not having any in-person consultations. We're not doing any type of surgery. Right now, the hospital where I work, they're very strict with these measures. So there's no non-urgent procedures. So that's why we're not doing any surgery for now. We're planning on opening up again in June. Hopefully, we will be able to do that. But as I said, this changes very rapidly. May is going to still be a difficult month here in Tijuana, and basically many cities in Mexico and in the U.S. and a lot of cities around the world. So hopefully we will be able to start scheduling surgeries in June. For now, we will start scheduling them. And unless something major happens that we can't go ahead with it, we would let you know. But for now, I think we're going to be able to do this. Of course, going back to work, many things are going to have to change. We're going to have to be extra careful for everybody, for my patients, for you guys. I want everybody to be safe. We don't want to take any risks. Also, the hospital staff, the medical team, we all have to be safe. So when we go back, we're going to have to have a lot of preventive measures and guidelines that we have to go by. About the hospital is going to be very strict with having everything cleansed, sterilized, so there's no risk of getting this virus when we go back to work. Also in the office, we're going to have to take a lot of measures of wearing a mask, using gloves, sanitizing everything. We're still not sure what the protocols are going to be for surgery. We're in direct contact with the American Society of Plastic Surgery and their recommendations and guidelines. There's nothing that's absolute or completely strict, but we do have to be very careful. We don't know if we're going to have to perform tests on patients before we go into surgery. That might be a possibility that we will have to do that. That's going to depend once we're there. The hospital guidelines and the recommendations of the American Society of Plastic Surgery and the Mexican Society of Plastic Surgery. So taking into account all of this information, we'll see exactly what we're going to have to do, but definitely we are thinking about your safety, and that is one of our most important concerns, that everybody's going to be safe. We'll let you know when it's time exactly what we have to do to start scheduling, but it's important to let you know that for us, that is one of the most important things once we go back to work, and we take this very seriously. Hopefully we're good to go in June. I know this has been a very, very difficult time for everybody. A lot of people haven't been able to work, are still spending money in our daily lives. Some people have lost their job. So as to make this a little bit easier for everybody, we are offering some discounts for June and July. So feel free to ask about this. We'll let you know all my contact information, and we'll let you know about these discounts that we're offering, so you can take advantage of this, and hopefully that will help everybody a little bit to go ahead with your plans, with what you've had in mind for a long time, to be able to fulfill all that you want to do. So definitely let us know, ask us about all this information. And okay, I don't know if there are any other questions, Maida. What should we do next?
So I think that just to be clear, a lot of people were wondering about the 20% discount that you're offering. So how does it work exactly?
Well, the idea is going to be the same as it was. We usually do our consultations via email. They contact me directly, and then my surgical coordinator, Aura, will contact you, and she will send you all the information you need. She will ask you to send pictures of the areas that you want to change, also to fill out a small questionnaire about your health, your general health. Then I'll see what is best for you. I will recommend a treatment, what is best for you, and of course taking into account what you want and what is best for you. With this, we have standard pricings, and knowing what we are planning on doing, having this standard price, we will do the discount on that list that we have. So the process is going to be exactly the same that we've always had. That's not going to change, but the end pricing is going to be better with the discount. We'll let you know what was the general price and the discount, 20% for everybody that schedules their surgery for June and July. If you're already scheduled, we'll figure that out. We will also help you and give you a discount with the patients that are already scheduled. But if you schedule now, from now on, we will give you that 20% discount.
Great, thank you. And for everyone that's watching, please feel free to ask questions, and he's here to answer any questions you have on any procedure that you may have, or just to say hello. I'll be reading off those questions to him. So, Doctor, I know that one of your specialties is post-bariatric surgery. So for whomever is watching that has been curious about this, what can you say to someone that this is their first, the first information that she's going to get regarding this surgery? So when do you recommend it? And what kind of physical health does the person need to be in for him or her to get this surgery?
Yeah, I mean, post-bariatric surgery is probably 95% of my practice. So that's basically what I do, post-bariatric surgery. I've been doing this for more than 10 years now. So I really like this type of surgery. I really like the type of patients that come with me. So the idea is that this means that once a patient has had a weight loss surgery, and they're overweighted, obese, they have the surgery to lose weight. Usually we have to wait around a year after the weight loss surgery so you can lose most part of your excess weight. After this, when your weight is relatively stable for, let's say, at least 3 months, you're stable at a weight where you're comfortable. It doesn't have to be your ideal weight. Sometimes it's not easy to get to your ideal weight, but we take into account your what gives us a general idea that you're ready for surgery weight-wise is your body mass index. So depending on your body mass index and other things that I take into account, will decide if you're a good candidate for this surgery. So it's usually a year after you have the weight loss surgery. And we have to see your body mass index. And usually, fortunately, most patients that seek this kind of procedure, they are relatively healthy because they've been through a difficult process, which is deciding to have the weight loss surgery, taking care of themselves after the surgery, losing the weight. Usually they start exercising, eating well. Big part of the comorbidities that they used to have before the weight loss surgery, that could be diabetes, high blood pressure. All that usually goes away, so they stop taking medications, which is great. The idea is that when you come with me for your evaluation, that you're in a good general health, that you're eating well, that you're exercising, you're at a good weight. Very important, smokers. That's almost a prohibition for this kind of surgery. It's very important not to be smoking. If you do smoke, I recommend at least to stop smoking 3 weeks before surgery and 3 weeks after surgery, minimum. And this means that not even one hit of tobacco, nothing. Just a small taste of the cigarette that has a direct effect on the blood supply to the skin and the blood supply to a scar. So we do have a lot of complications with the scarring process if you're smoking. So usually wait for a year, have a good general health, no smoking, that you're relatively stable in your weight, because it's not a good idea to do the surgery if you're still losing a lot of weight or you've lost and then you start gaining weight. So you have to be kind of stable on your weight. You're going to see that during this process, when you lose this weight, you get rid of one problem, which is obesity, overweight, but then comes a second problem, which is that you're going to see that the skin starts to get very lax, then it starts to hang everywhere. The abdomen, the thighs, the breast, the arms, the butt. So once you get rid of the first problem, then in comes the second problem, which is where I take care of that. So it's going to affect the whole body, starting with the face to your legs. So we have to do a lot of surgeries. I usually do 3, sometimes 4 surgeries to take care of all your body. A lot of my patients, fortunately, go through with all that process, with many surgeries, and we end up doing the whole body. So the changes are really nice. It's really amazing to see how my patients go through this very long process, but at the end, it's really worth it because the lifestyle is absolutely and dramatically improved, which is a general idea. And they feel really good. They feel great. They start doing many things that they weren't able to do before these surgeries. So it can be a long process. There are some patients that are only interested in, let's say, the abdomen and the butt, and that's the only surgery they do. So it depends on each one of you. But there are some patients that go through with the whole body. So we start depending on what you prefer, what's your main interest, and I'll let you know which is the best way to go. I do combine some procedures, some I don't. I don't do the whole body in one surgery. For me, that's impossible. I know there are some surgeons that do that. I can't. I don't. For me, in my hands, it's not a good idea to do that. So we do have to split into a few surgeries. So that's kind of like the main picture of what goes on with a patient that goes through a weight loss surgery and goes through all this process.
A lot of, for many of those that don't know, for example, if they get post-bariatric surgery, can they also get breast implants within that same surgery?
Yeah, absolutely. Yeah, during the whole body process, I sometimes combine. When I do the abdomen, I always do, if you need it, which most patients do need it, the back part and the butt lift, the buttocks lift. Sometimes I combine the breast surgery with that procedure. But in whichever stage it is, we do a breast surgery. So this depends on each patient. There are patients that very few don't need anything. Some patients just need a breast implant, which is not many. Most of my patients need a breast lift. And that's when we have to decide if we can do the breast lift with implants or without implants. We usually can do it with implants. Without implants, it depends. There are patients that are good candidates for that procedure to do a breast lift without implants. There are some that are not very good candidates. But if you want to increase the volume, the size, then of course we can use implants during that surgery. So we will have to evaluate individually if you're a candidate for using implants or not. Or there are a lot of patients that now prefer to do a breast lift without implants, which is another surgery that I really like to do. So it depends on what you want and what can be done. But definitely a big part of this is doing the breast lift with implants or just a breast augmentation that we would have to see individually what's the best thing for you.
Okay. And then for those that are not ready for post-bariatric surgery, that's not the procedure that they need, let's talk about liposuction. Mm-hmm. I know that right now these are difficult times and a lot of us are eating more than we should. So what can liposuction do? And when do you recommend? Is it when you are, 40 pounds over, 100 pounds over? So for those who have never heard or are curious about liposuction, I guess what's liposuction 101? What can you say about it?
Well, I know during this time being at home without probably exercising what we should, all of us were eating a little bit more than we should. But the idea of the liposuction is, first, it's not a procedure for losing weight. There are a lot of patients that are overweighted and they think that with a liposuction, we're going to solve that problem. And that's not the right way to go. Because liposuction is not for very big amounts of fat that you want to take out. For me, the idea of liposuction is taking care of a few areas of your body that even if you're at a relatively good weight, if you do a little bit of exercise, you eat okay, and you still have those areas that you can't get rid of. There are a lot of patients that really exercise and eat well, and they can't get rid of those certain areas of fat. So those are the best patients, the best candidates. If you're overweighted, if your body mass index is quite high, then the liposuction is not a very good idea. If you do a very aggressive liposuction, take out a whole lot of fat, a few things can happen. One is that you're going to lose a lot of blood, because during the liposuction, you do lose some blood. And that's not the idea of the surgery. And then also depending on your skin quality, the more fat that you have to take out, probably the less adaptability your skin will have after surgery. So if you're at a relatively good weight, but you still have a few pounds extra, liposuction in the back, the flanks, which is what we call the love handles, the abdomen, sometimes the arms, the thighs. It's a very good opportunity to improving the contour. It's not about the weight, but it's more about the contour. To have a nicer shape, to bring out your real shape, your bone and muscle structure, so you can see it. Because sometimes we have a certain amount of fat that you can't really see the real muscle and bone structure. So the idea is to improve that silhouette, that shape. The body, that's why we call it the body contouring, because you contour the body by taking out the fat. Also, it's important to, for example, massive weight loss patients, some of them ask me to just do liposuction. It's not a good idea. We have to adjust the skin, because if we do only liposuction, the skin is going to hang more, and it's not a good result. But the patients that are not a massive weight loss patient, that they're just eating a little bit more, they have a few extra pounds, and this is a very good technique to take care of that extra fat that sometimes is quite hard to get rid of. So it's a quite safe technique. Techniques have changed. It's been much safer. We almost take advantage of the opportunity to using your own fat to improve the butt contour and size. So when we do liposuction, a lot of my patients, we also add the what we generally call the Brazilian butt lift, which is taking your own fat from anywhere in your body and putting it into the butt to improve the size, the shape, the contour. And the beauty of that is that I can manipulate as best as I can, depending on what you want to have a better shape. There are patients that like larger butts. Some patients like it a little bit rounder. So we can play a little bit with what you expect and what can be done also. I'm not very prone of doing very, very large fat transfers, but usually it's a very nice result to have a very nice shape. So you can put on a pair of jeans or pants and have a very nice butt shape. So that's usually something that we can also add during the liposuction.
And when if the patient considers doing the Brazilian butt lift, how long does the butt lift or last?
Well, after a surgery, during the first 8, 10, 12 months, up to a 30% of the fat that we transfer to the butt may go away. That's something that we really can't do much about it. It's just the way it is. We've not been able to avoid that. So in the first year, it will change a little bit. It will, the volume will come down a little bit. But once the fat settles in, the fat stays there forever. It becomes your natural fat in that area. So once that 20 to 30% goes away, the rest is going to stay there. and it's not going to go anywhere. It's going to, if you exercise, you work out, and you increase the muscle volume, it's only going to look better. So it's going to last for the rest of your life.
Wonderful. And just lastly, a lot of patients ask, they're curious about whether to do a breast lift or breast implant. So what can you say about that?
Oh, well, that depends on each patient. There are patients that don't need the breast lift. The idea is that to have an idea that if you need a breast lift or not, is that the nipple and the areola complex should be above your breast crease. When the nipple and the area are above that, you usually don't need a breast lift. Sometimes if it's right near there and the lower pole of your breast is underneath the crease, I do a circular breast lift. That means a scar that goes around the areola, and that's it. If it's lower than the crease, then you will most likely need a breast lift, which is the scar that goes around the areola, and a vertical scar. I try to avoid the horizontal scar, especially in patients that are not massive weight loss patients. I try to avoid that scar. In massive weight loss patients, we usually do have to do the vertical and almost always also a segment of the horizontal scar. But with that, we're able to bring up the nipple, the areola, and the breast tissue. And that's when we can decide if adding an implant will be a good idea or not. So that's when we'll decide exactly which technique. But that's the general concept. Your nipple and areola is lower than the breast crease, then most likely you will need a breast lift to improve the shape.
Wonderful. Well, doctor, thank you so much for your time. And just as a reminder, for those that joined a little bit later, just if you could just remind everyone when you will be ready for surgery again, to do surgery now.
Yeah, as I said at first, this changes very rapidly. At first, we were hoping to go back to work on May, but now, as the things are going on here, we'll probably be good to go on June. Starting June, the hospital is going to reopen, and as I said, we're all very serious about your safety. So even though we go back in June, we're going to have very strict measures to protect you guys, the patients, and protect everybody, the hospital staff, the surgical staff. So we'll have to go through some protocols. We'll see exactly how they're going to go. They're still not in place because we're still not active. We'll let you know in time what exactly we're going to have to do to be able to go ahead and schedule surgeries. But we're most likely to be able to start in June.
Doctor, we have a question from one of your patients, and she's asking that she's scheduled for a body lift, lipo, and BBL in June. And what are the top 3 recommendations to ensure a healthy recovery?
Well, first, it depends that your general health. I'm positive that you're in a good health. No smoking, very important. And afterwards is to go through your pacing and the recovery. There are patients that feel pretty well after a week and they want to start doing a lot of things and going out and lifting and driving, and that's not a good idea. So I'll let you know exactly which are the steps that you can start doing depending on the weeks that are going by, your activity that you're going to start to regain. Slowly but steady start to increase your activity until you're good to do anything. But that does take about 6 to 8 weeks for you to be able to start doing your regular activity, including exercising and all that. So one is gonna be make sure that you're doing what you're supposed to be doing in your recovery, in your time. Medications, I usually recommend medications for the first week. Usually after that, there's no need for medications. First days after surgery, very important to drink a lot of water. That's very important. You most probably will have to start taking a iron supplement, which patients that are in their, not anemic, because if you're anemic, we can't do the surgery. But if you're in like the borderline of good and not so good, it's a good idea to start taking iron supplements about a month before surgery, which you can do regardless of your hemoglobin. You can start doing that, and after surgery, also take iron supplement for at least a month. That's going to help you recover faster. You have to wear the post-op garments, usually for a month, and after that, just take them off. There's no need to extend that. And that's basically, if you stick to your plan of what you can do, when start doing it, then the success is going to be much better. Of course, there can always be complications. Fortunately, they're low. The probability of having that is very low. But if you adhere to your recovery plan, then we're most probably going to have a very, very good outcome.
Doctor, you mentioned no smoking. What about alcohol? Are you able to drink alcohol prior and after, just to be clear?
The alcohol does not have an effect on the scarring process or your general healing process. It's not recommended when you're taking medications, especially an antibiotic. So it's good not to drink anything. I would say at least 2 weeks after surgery. Before surgery, I mean, you could drink a little bit, I guess. The thing is that alcohol in large amounts dehydrate you. So it's very important to go into surgery very well hydrated. That's very important. During surgery, Dr. Acosta, my anesthesiologist, will take very good care of you, and he'll give you a lot of fluids through the IV if you need it, but it's better to be well hydrated. So alcohol may dehydrate you. So it would be a good idea to drink a lot before your surgery. You can take, probably a few days before that, if you drink a little bit of wine or 1 or 2 beers, but that's it. After that, you can, but also with not exceeding your limits.
Great. Well, thank you so much, Doctor. And this is going to stay up on your social media for whomever wants to kind of take a look at it again if they had some questions. And as always, your email is right here for everyone to see, drsalvadormedina@gmail.com. And then you are doing e-consults right now for anyone that needs to, get an e-consult. You're doing them currently, correct?
Absolutely, yes.
Great. Well, thank you. Thank you so much. And everyone that joined, have a wonderful night.
Okay. Bye-bye. Thank you very much.
Thank you.